Thank you for joining us. I'm Guy Carrick with St. Elizabeth Healthcare in Edgewood, Kentucky. Today we're going to talk about the latest robotic technology, Mazor X. And I want to remind viewers, if you do have any questions, feel free to submit them throughout the broadcast as well as the afternoon, and we will answer them as we receive them. At this point, I would like to introduce Dr. Nichols. He is a neurosurgeon with Mayfield Brain and Spine. Dr. Nichols, welcome. And could you briefly explain what your specialty is and what you do as a neurosurgeon?
Certainly, Guy. So as a neurosurgeon, we work on conditions of the nervous system. So this includes problems of the brain, problems of the nerves and the spinal cord, as well as peripheral nerve problems. So we focus on things that have surgically correctable options for treatment.
Okay. I think the first question, I'd like to ask you an open-ended one, just talking about the procedure with the Mazor X and spinal fusion, and then we're going to show a brief video. So if you could just talk about the procedure first.
All right, well, the Mazor X is a new robotically assisted pedicle screw placement device. So this is an additional tool in our armamentarium to treat people who need spinal fusions. So spinal fusions are conditions where there's instability in the spine that needs to be fused. So traditionally we've placed bone and various screws and other clamps to hold things in place. What the Mazor X allows us to do is improve the precision of this using robotic technology as well as image guidance and pre-planning.
Okay, and I think at this time we're ready to show a brief video clip. Okay, Dr. Nichols, now that we've seen a brief video, could you describe some of the benefits with this procedure?
Certainly. So the advantage to the Mazor X is it increases the precision of placement of pedicle screws, which are fixation devices placed through the back side of the patient into the pedicles and vertebral bodies of the lumbar spine to stabilize it. A couple advantages. One, we can plan this before we start. So traditionally, we look at MRIs, we look at X-rays, we look at CAT scans, we make a general plan of what level we're operating on, roughly what size of screws, and then this all gets adapted when we actually get into the surgery. With the planning ability of the Mazor X, you can plot exactly where you want your screw to go, which will allow you to optimize the size of the implant. For example, you can make a wider screw in an area that has a little more space, perhaps a longer screw. In general, the larger the implants are, the better purchase you have. This isn't much different than carpentry. If you can get a bigger screw into something, it's going to work better. And because the precision with the robot, you can fit that device into that spot that might feel too tight of a fit if you were to do this more conventionally, which is based on either X-ray or freehand placement.
Okay, and what are some of the benefits to the patient with this procedure?
Well, several things. One, it tends to reduce the duration of the surgery by a bit, especially in larger operations. There is a bit of setup like anything in life, but as you get going, each screw placement becomes a little bit faster, which decreases anesthesia time, which tends to decrease length of stay and also improve your recovery. In addition, it allows us to, as I said, optimize the placement of the screws, which tends to give you better outcomes. So less need for revisions, hopefully some better pain results, and also allows us to tackle cases that may be too difficult otherwise to do due to abnormal anatomy. Oftentimes when people have particularly thin bone or curvature of the spine, it's very difficult to see on X-ray. And with the CT you have before the Mazor and then the robotic assisted placement, you get a more accurate pedicle screw placement, which gives you more adaptability to adjust the spine to what you're trying to get. It allows you to focus on the surgery rather than on the planning.
Okay. And as a patient, how would I know if I need a spinal fusion?
Well, the easy answer is you don't. That's why I still have a job. Usually we don't need to fuse your spine. In fact, usually we don't even need to operate on you. Over 70% of folks who have back and leg problems can be treated with non-operative treatments. So you really don't know. But that's why you need to see someone, get started on the non-operative options. If those don't work, then you're evaluated by someone like myself, and to see if you're a surgical candidate. Not all surgeries necessarily require fusion. Most lumbar fusions, though, if we do need that, can be used. You can use the Mazor X in those fusions.
Okay, so what might be a condition that would lead me to you to say, can you check my spine?
Sure. Well, generally anyone who's had severe back or leg pain, classically it's longer than 6 to 12 weeks, but that's not always the case. And there can be a whole host of problems. I mean, some can be simple things like muscle pulls, strains, which are going to be treated with therapy and medications, and some more sort of structural problems like spinal stenosis, which is essentially arthritis of the spine, ruptured lumbar discs, malalignments of the spine, and obviously some of the more scary things like trauma and tumors and things of that nature, which are fairly rare, thankfully.
Okay. And approximately how long does this procedure take, and is it safe? I think people always want to know that before they have a...
Right. So the length of time for lumbar fusion varies quite a bit. Anywhere from 2 hours to 4 to 6 to 8, depending on what you're doing. Like anything, the more segments you're involving, the bigger the surgery, the longer it's going to take. The more abnormal your anatomy, the longer it's going to take. So these are not quick surgeries by any stretch, even the relatively small ones. And I would say they are certainly safe. Like anything in medicine, there are risks associated with it, but we've slowly improved both outcomes as well as complication rates over the years due to a combination of improved anesthesia, improved placement with things like the Mazor X, and better understanding of the anatomy of the spine, which allows us to do less and get more.
Okay. I do want to remind viewers, if you have any questions, feel free to submit them using the comments section. So now we've had the surgery, we've had the procedure. What happens next? What happens after surgery?
Right. Well, unlike, say, 10, 15 years ago, where most people would spend several days in bed after one of these surgeries, the goal is rapid mobilization. Get you up, get you moving. So most people are sitting in a chair the day of surgery, maybe a little bit of walking, oftentimes home the next day, maybe a day after that, doing some walking, potentially a stay in a rehab facility if necessary. But people are up and moving quite quickly. And this is no different than some of the total joint improvements you've seen in the last few years. People get rapid mobilization tends to improve outcomes. Same thing with the spine. The faster you get up, the faster you move, the better you do. Most people notice a pain reduction relatively rapidly. First few days can be a little tough. I mean, it's surgery, it still hurts. But once you get over the surgical pain, the majority of patients will find that their underlying back pain is at least subsided quite a bit and tends to continue to improve over the next few weeks. I personally tell people, it takes about 12 weeks to recover from a fusion. But 12 weeks doesn't mean you're in bed for 12 weeks. Doesn't mean you're not working for 12 weeks. Doesn't mean you're not playing with your grandkids for 12 weeks. It just means you're not 100%. Yeah. It takes time to get, it's like putting money in the bank for later in life. You got to put it in up front to get the benefit down the road.
Right. So I was going to ask about when you can resume lifting and your activities of daily living, but it sounds like within 12 weeks.
By 12 weeks, I tell people you're about 80-90% of recovered. Usually by about 2 weeks, people are back to driving, maybe a little earlier. They're back to doing some light house work. They've been taking care of themselves well before that. So people have this image that they're going to come home and have to lay around and someone's going to have to peel them grapes and bring them all their food. But in reality, you can get up and get your meal, clean yourself up, and take care of those kind of things. The house might get a little bit dusty, but you can clean that up later. And then, in that 2 to 4 week range, people start resuming more activities. Sometimes they go back to work if they have a job that doesn't have a high physical demand, start doing some housework, start going out with friends, things like that, and then gradually resume more activities. Unlike anything, the more strenuous an activity is or your occupation, the longer it may take to recover.
Okay, and I know you and I talked briefly about this before the broadcast. Is there an ideal candidate? I mean, can you describe a candidate for this procedure?
So lumbar fusions are best done on patients with limited spine problems. Doesn't mean limited pain, but it means an area of badness, if you will. If your entire spine is just bad, oftentimes surgery is not going to be too helpful. I tell people this is not much different than, rehabbing your house. If the entire side of the house is bad, you might be a lot out of luck. if you've got a bad little corner, we can go in and fix that up. And people have the best outcomes when they have one area that we can address. No matter how bad that pathology is there, we can usually fix it. Where outcomes start to drop off is when you start fixing more and more. Now, you can still get some very good outcomes by doing very large surgeries if you appropriately pick the patients. But in general, if you have a focal problem that's causing referable pain, so we can track back and say, okay, we're pretty sure this is where the pain's coming from, then we can fix that structural problem and resolve a good deal of your pain, get you back to regular life.
Okay. I just have a couple of wrap-up questions. Why was it important for St. Elizabeth and Mayfield Brain and Spine to offer this new technology?
So Mazor X was coming, whether we got involved with it or not. So we felt the need to be on the forefront, both through the St. Elizabeth Healthcare and Mayfield Brain and Spine, to be able to provide the best new treatment options to our patients. Robotic surgery for spine, robotic surgery for other things is here, and it is improving the outcomes. And we thought very important to be part of that. In addition to not only providing good quality care to patients here, but also to helping advance the technology. Because like anything, the more cases done, the more we learn about it, the better it is for everyone.
So do you see this as a game changer for neurosurgery?
I think it will be. I think right now it improves what we can already do, and I think there's some new technology coming both through Mazor X as well as some other robotic options that will start to dramatically alter how we do surgery and offer options to more patients. The ultimate goal is to not only be able to achieve better outcomes with who we operate on now, but to offer options to people who otherwise wouldn't be good candidates, either because of health problems or the nature of the surgery. And ultimately, while you don't want to have to operate on people, if you need to, you'd like to be able to give them better options.
Okay. Well, that's really all the questions that I did have at this time. I do want to remind viewers, though, if you do have any questions, please submit them on the comments section. We will be checking those throughout the afternoon, and we will respond to them as we receive them. And at this time, Dr. Nichols, I'd like to thank you very much for giving us your time and being here to lend your expertise today.
Thank you, Guy.